Person is unable to say anything intelligible, try playing 20 questions. Are we talking about a glass of water? Are we talking about clothes? Use gestures, pictures, and objects when appropriate.
Ask him questions, because he can say yes or no a lot of times to a question that he can't get the whole sentence straight. Like I'll say, are we talking about a person? Are we talking about a place? Are we talking about food? And actually, I ask him, talking about a person, he'll say yes or no. We're talking about a place, he'll say yes or no. And then, if we're talking about a place, I'll say, we're talking about home. Are we talking about your home? We're talking about, Terry's house. And you just go through all that. And eventually, when you know the topic, then you can kind of understand what it is he's trying to communicate to you.
For some people with aphasia, written words can help to increase understanding and expression of ideas. Ask the person to read or point to words. Reading aloud can improve speech. People with aphasia often have a hard time finding a particular word. It may be helpful to repeat what he has said thus far. You can try using a sentence completion. I want to put on my blank. He may be able to say, I want to put on my shoes, by using the sentence completion, where he wouldn't be able to come up with the word shoes on his own.
I know it, I just can't say it out to you. I know what the thing.
And that's one thing too that we will do is start to say the word, and a lot of times that'll trigger it and she can say it.
A routine daily schedule is helpful. Being in a predictable situation promotes a sense of safety. Repeated exposure to the same objects and events provides an opportunity for relearning language. Signs indicating objects or areas within the home can sometimes help a person to relearn language skills. Be honest. Tell the person that you can't understand what he or she is trying to tell you by saying, I can't understand what you're trying to say, rather than, you're not speaking clearly. Try changing the subject or coming back to it later if he or she is impossible to understand.
It can be very frustrating if your loved one or the person you're caring for is now starting to do a lot of swearing, especially if you never remember them doing that before. It almost seems uncontrolled to them, and in fact it is. They're not able to stop doing that. That occurs at a level in the brain that they just can't seem to stop it, and it's not anything that they are using appropriately, although sometimes it may feel that that's what they really wanted to say. Remember that they cannot control it. They will also be able to say one word one time, and then when you ask them to say it again, be totally unable to. And that again is the processing problem. We know it as apraxia, or just inability to program or voluntarily say what they want to say. It'll come out automatically one time, the next minute they cannot use it when they really want to use it.
People with aphasia need time to understand what you are saying. It's important to be patient and allow them time to process the information and to find the words they want to say.
One of the things that was hardest for us to learn, but was the most important thing to do with Mom, was let her finish what she's trying to say. Do not try to put words in her mouth. Do not try to finish the sentence for her. And that's what we have tried to do, because how are they ever going to learn to communicate again if you're always finishing every sentence for them or put everything into their mouth form and telling them what they're trying to say? And I think that's one of the hardest things. I see her friends still do it because they don't understand that. You just need to have some patience. Give them a little bit of time.
In normal conversations, we take turns. We are the speaker, and then quickly we become the listener. Sometimes caregivers anticipate the wants and needs of the person with aphasia, and the turn-taking becomes lopsided. The caregiver dominates the conversation. It is important that we continue an even exchange, even if the person's speech is difficult to understand. Keep a positive attitude. Take time to do the things you enjoy. Setting aside time for yourself will help you to keep a positive attitude. Emotional ups and downs are to be expected when someone has had a stroke. Try not to take it personally.
The one thing that they told us is that stroke patients will have emotional ups and downs, and they can hit really fast. 1 minute they can be laughing, next minute they can be crying, and that was really hard to see your mother, who I remember only one time in my life seeing her cry, and all of a sudden I see her bawling, just boom, and I would start crying, and it would be really hard, and I'd ask her, please don't cry. Now I know that's just part of her stroke. It has happened to her, and it's usually when she's really tired. And I just say, you know what? You need to go back to bed. You need to take a nap. And she does. She knows too now. Yep, I'm not handling life very well right now. I need to go back to bed. And
When you're caring for someone with aphasia, share the responsibility as much as possible. Don't be afraid to ask for help. Involve your family and friends in the process, or get outside help if necessary. Stimulate new ideas and topics by getting the person involved in outside activities. It can be helpful to take a walk or go for a ride in the car. Stroke clubs offer support, encouragement, and education for families who are coping with aphasia. Talking with other people about your experiences and feelings can give you hope and restore your sense of balance. Adjusting to the changes caused by aphasia can be challenging for the person with aphasia and for family members. Finding new ways to communicate and making the effort to communicate is an important part of the healing process. The techniques presented in this video have helped many families improve communication as loved ones work to recover speech and language skills. If you try just one of these techniques and it works, it opens the door to communication. It is well worth the effort.
I just go over and say, honey, we gotta be cool. And I try to, in situations like that.
You do. This one is to purse your lips and your throat and throw a kiss. So close.
there are times we joke around and we tell her, do you ever shut up? Do you ever stop talking? Because it seems like there are times driving down the road all the way in town, all the way back, that's all she does is talk.
You mean you don't understand me when I'm telling you how funny it is?
Not always.
Oh, shucks. I know you did.